Minoxidil stopped working. Should I move to PRP, or is there any other solution? Need suggestions. I'm 26 years old, and it's been 1.7 years since I've been on minoxidil. It first gave me an awesome result, but after 6 months, I started shedding hair. Now it looks like this. I started finasteride when I first started using minoxidil, but after using finasteride, I had a lot of pain in my testicles, so I just stopped using it and continued with minoxidil. Now what to do? Do I go for PRP or hair transplant? How many grafts do I need now? Some images were took when I had applied minoxidil on my scalp, and some of them are of my dry scalp.
Thank you for your question. You've submitted several photos of the top of your scalp, and you're stating in your question that you were using minoxidil for a period of time, about a little bit, almost close to 2 years, and that apparently the minoxidil it stopped working after about 6 months. You also state that you were taking finasteride, and unfortunately you felt that the finasteride was causing testicular pain, so you stopped that. And so now you're asking whether or not you should get PRP or a transplant. Well, I can give you some guidance as to how I answered these questions in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Hair transplant has been an important part of my practice for many years. I'm also the founder of TrichoStem Hair Regeneration Centers, and this is a technology we developed that evolved out of hair transplant, and it uses PRP, platelet-rich plasma, and acellular matrix, which we developed into a system to help men and women from all over the world who suffer from androgenetic alopecia. So, to begin with, it is certainly important to understand that you have to choose when to do a transplant very strategically if you're going to do it at all. And basically there is a challenge depending on the age of onset and the rate of progression and the degree of hair loss. Now when I look at the photos of the top of your scalp, it looks like you have very diffuse thinning. Well, when you have diffuse thinning, a hair transplant is usually not that practical. The reason being that when you have an area, for example, which is very smooth and has no hair, well, that's an ideal place to do a hair transplant because you can actually place the grafts in that area and not worry about existing hair. When you have a lot of existing hair, even though it's thinning, what you are going to end up with something called collateral loss, where when you do transplants into those areas, you're making multiple stabs. Let's say you're getting a transplant of 1,500 grafts. Well, that's 1,500 incisions being made into your scalp, and that will result in collateral loss. So I think that most transplant doctors would not be excited about doing a transplant in your situation. Now, where does the role of PRP as well as our treatment, hair regeneration, fall? Well, we learned over many years of doing this procedure, and specifically to differentiate PRP from hair regeneration. PRP is platelet-rich plasma, and platelet-rich plasma is a concentration of the wound healing and growth factors that are necessary when you get a cut. We use PRP a lot in our practice. We use it for wrinkles, we use it for under-eye dark circles, we use it for acne scars, we use it a lot for skin improvement. But what we have observed, and certainly the feedback I get from patients who come to us who have gotten PRP done elsewhere, is that the effects of PRP are relatively short-lived when it comes to hair stimulation. What is effectively happening is the PRP is stimulating hair growth in a way that can prolong the life cycle of that hair. Unfortunately, with PRP injections, you have to do them relatively frequently. I have heard of patients going to places where they went once a month, which you can imagine is difficult to sustain, no matter how motivated you are. Hair regeneration, which is for our practice, which we developed and we started the company TrichoStem Hair Regeneration, evolved around 7 years ago when we were doing hair transplants, which initially we were using this acellular matrix, which is a wound healing material that leverages your body's ability to generate stem cells for wound healing, combined with platelet-rich plasma. And we were doing this to help improve the graft yield of the transplanted hairs, as well as to improve the donor area. A side effect, a benefit, was that thinning hair became thicker. And we've been treating men and women of all ages in large volume for the past 7 years, and the overall majority of patients have had a benefit that has sustained for 5 years. We customize the treatment in terms of concentrations and methods of delivery and a lot of things based on protocols derived from experience. But what I can caution you about is, and I cannot tell what age you are by the photos, is that if you fall into the younger age group, and this was where I would say under 30, where you have a young age of onset, and whether it's a rapid or moderate rate of progression, intrinsically your hair loss issue is more aggressive than would be the male who comes in their 40s and 50s who have a similar type of clinical picture. And this is very important. So when you think about management, you do have to understand that your pattern is more aggressive. And PRP, as well as hair regeneration, is essentially pushing the growth cycles for as long as is possible for that hair follicle. What we have learned from doing platelet-rich plasma and acellular matrix combination, we've been able to see stopping of the progression of hair loss. We've been able to see a reactivation of hair that is not growing. We've been able to see thickening of thinning hairs, effectively prolonging the time as well as the quality of the hair. However, I would say that the best candidates have been people who have moderate degrees of hair loss with a relatively moderate level of aggressiveness. So these are people who can be as young as their 20s, but their progression is a slower progression, as opposed to a younger person who has a more aggressive progression. Again, we've been able to establish a significant benefit in terms of 5 years with a single injection, and we've adjusted the protocols for other patients who have more advanced hair loss. But certainly we've been challenged by younger people who have more aggressive patterns, and we may not be able to get to that 5-year mark, even though we can still prolong the growth cycles as much as possible. Now, that being said, I think that it's important for you to also speak to your doctor about the side effects of finasteride that you experienced. You may or may not be making a causation error in terms of the effect of the drug and the testicular pain you're experiencing. Again, certainly finasteride, like any medication, can have side effects, but generally speaking, in my experience, finasteride has been well tolerated in prescribing for patients for over 20 years, and patients and our colleagues from around the world also feel comparatively the same. Yes, the original studies showed about 2% of men had sexual side effects, but this was both in the active drug group and the placebo group. And so there is certainly multiple causes for these types of symptoms, whether it's sexual side effects or testicular pain. So it might be worth considering or maybe trying an alternative drug such as dutasteride. But again, this is a discussion for you and your doctor. So think about stabilization, think about maximizing the lifespan of your hair, and trying to buy as much time as possible before you move forward with a hair transplant or require a hair transplant. So I hope that was helpful. I wish you the best of luck, and thank you for your question.